environmental exposure to not only actually to ovarian aging, but also to detrimental effects in male fertility and also detrimental effects in the offspring. So it is really a very important matter. I have no conflict of interest for this talk. So premature ovarian insufficiency is cessation of menstruation before the age of 40 years. When I started working in premature ovarian insufficiency back in 1996, actually it was a quite rare condition, and the literature was mentioning a 1% prevalence. So a recent meta-analysis shows that the global prevalence is 3.5%, and actually even in our practices, probably most of you, and actually I see a great increase in premature ovarian insufficiency and actually a decrease in ovarian reserve. So in that meta-analysis, premature ovarian insufficiency due to iatrogenic etiology was 11.2% and autoimmunity 10.5%, meaning that the rest, almost 80%, is of other etiology. Actually, genetics also play a role, and we find now more genes. But I don't know how many of you have realized that climate change and environmental pollution plays a major role in the dramatic increase of ovarian aging. So this is something that we all see, I think, in our practice, that the trend of prevalence of premature ovarian insufficiency over the past 20 years is on the rise. So apart from the genes, that is something that does not change, environmental factors, and in particular nutrition and epigenetics due to environmental pollution and heavy toxins play a major role. So this is something that attracts the attention even from the World Economic Forum, showing the global decline of the fertility rate worldwide. And 3 years ago, ESHRE mentioned that exposure to environmental pollutants and toxins can be directly toxic to eggs and sperm, leading to infertility. So many things that maybe we do not realize affect fertility and ovarian reserve and even cause premature ovarian insufficiency. It is the flood, the fires, the environmental toxins that they actually, through nutrition, affect female and male fertility, and also they can have transgenerational effects and severely affect the health of the offspring. So environmental disruptors affect, it is something, it is well known, it affects the metabolism, causing obesity and type 2 diabetes. These are very well known, even gestational diabetes. And now we know that endocrine disrupting chemicals that are basically all over the place, they can cause thyroid dysfunction, metabolic disorders, but also mainly severe reproductive disorders. So epigenetic changes, as I mentioned before, now we know that they can be passed to the next generation through epigenetic changes and modification of germline epigenetic programming. And we can have in the offspring metabolic disorders, diabetes and obesity. We can have male reproductive abnormalities. So I will talk a little bit also about male reproductive abnormalities, female reproductive abnormalities, which is the main topic of my lecture, but also cancer as well. So something that we see in our everyday practice, the decrease in AMH levels, even in very young women. We see the increase in premature ovarian insufficiency. And actually, I have to mention to you that We are about to publish the new guidelines for the management of premature ovarian insufficiency from ESHRE and ASRM, and we have a new definition requiring only a few months of amenorrhea, 4 months of amenorrhea, and only 1 FSH levels greater than 25 units per liter, because we see that there is no reason to ask for another FSH that may decrease the diagnosis of premature ovarian insufficiency. So apart from the chromosomal defects that we know and we learn the genes that may cause ovarian failure, exposure to toxic substances is a major cause of ovarian insufficiency and a major reason why we see this increase in the last 20 years. So as I mentioned before, endocrine disruptive chemicals are all over the place in our everyday life. Pesticides, air pollution, plastics, cosmetic products, and food packaging. And unfortunately, even in the breast milk, we can find these substances. So this is really important. And we have a deterioration in medical and physical health. And actually, something that we don't realize as well is the detrimental effect even in mental health. So the impact of climate change is in every aspect by decreasing health and decreasing life expectancy. So that made the World Health Organization to declare that climate change is the single biggest health threat facing humanity. And actually, every year, environmental factors take the lives of around 13 million people. So if we see that, and by taking into account that there is also a detrimental decrease in both male and female fertility, and there is also a detrimental effect in the offspring, then we can realize how major is the impact of climate change. So that was the topic of the cover of medical journals. And one of the first things that are happening is we have an earlier menarche. There are some epidemiological studies showing that there is an earlier menarche. And actually, earlier menarche may be associated with other health consequences. But what we see is also menstrual disturbances, infertility, increase in miscarriages, gestational diabetes, low birth weight, preterm birth, and stillbirth as well. I mentioned earlier we see changes in milk composition. We see early menopause, not only premature ovarian insufficiency, menopause at earlier ages, and actually even the menopausal symptoms are even heavier. And we have shown with my research, and other investigators also have shown, that the severity of menopausal symptoms also are a marker of cardiovascular disease, which is the leading cause of death in both men and women. So through the food and the nutrition, all the effects of climate change increase health disease. And actually, we are now talking about the decrease in ovarian reserve, ovarian aging, and premature ovarian insufficiency, but other diseases, reproductive diseases, are also associated with climate change, like endometriosis, uterine fibroids, even cancer, gynecologic cancer is related to climate change. And although we are thinking the one end is the decrease in fertility and ovarian aging, but also polycystic ovary syndrome is also associated with climate change. And we see that actually the endocrine disruptive chemicals can cause polycystic ovary syndrome. Actually, this can be caused not only through the endocrine disruptive chemicals, but also through junk food, the well-known advanced glycation and products. So polycystic ovary syndrome, it's also increasing its prevalence the last years. Almost 1 out of 10 women has polycystic ovary syndrome. And polycystic ovary syndrome is also associated with an increased risk for endometrial cancer and heart disease. Now let's go to the topic of my talk. What about environmental toxins and ovarian aging and premature ovarian insufficiency? Actually, I think it's almost a decade now that we realized that environmental toxins is a major cause of premature ovarian insufficiency. And actually, this is something that we should check, especially in girls, in young girls that are living in areas that we know that there is increased atmospheric pollution, environmental pollution. And I will show you even studies that have been published just a couple of months ago at the last ESHRE meeting. So many studies right now are showing the detrimental effects of environmental pollution in the decreased ovarian reserve and ovarian insufficiency. These are some of the clinical studies published so far. We found at the end of last year 3 clinical studies, and during the last year, the 2024, there are many studies that I will show you. So all of these 3 studies that have been published until the end of 2023, they were about investigation of the fluid, the follicular fluid during IVF. And in this study, they showed that environmental pollution was associated with the increased expression of FSH receptor and also with the increased rate of programmed cell death, apoptosis in granulosa cells. So we have some evidence from IVF findings from the follicular fluid during oocyte pickup that there is detrimental effects. And actually, these detrimental effects are responsible for the dysfunction in granulosa cells, but also in the quality of the oocyte. So starting from the 2020, there have been some studies linking environmental pollution with AMH levels and also chemicals. There were some, this was one of the first studies showing that environmental pollution is associated with, is adversely associated with the success of IVF, but now I will show you more recent data that emphasizing the detrimental effect. Also, it was shown that environmental pollution is associated with decreased ovarian reserve, with a decrease in AMH levels, and in that study it was age independent. And now we know that environmental pollution can increase at least by 20% the risk for infertility. Even the proximity to major roadways, it seems like it may have an effect. Like women who are living very next to major roadways, like less than 50 meters, have a decreased risk for having a baby following IVF compared to women who live more than 400 meters from a major roadway. So all the studies are showing this detrimental effect, and somebody might say we don't know if it is the quality of the oocyte or maybe there are other parameters related to embryo transfer or the uterine environment, and this actually was answered in the study that I mentioned to you earlier, that it was presented at the last ESHRE meeting, and it was proof that it is the oocyte quality, a quite scary finding. So environmental pollutants induce damage in folliculogenesis, leading to ovarian aging. And the scary thing is that they do not only cause epigenetic modifications, but they also cause transgenerational detrimental effects, which means that they can go to the next generation. And there are multiple aspects for this. As I mentioned earlier, either menopause can come at an earlier age, and the hot flashes and the other menopausal symptoms are more severe due to climate change. This is a study that was published some months ago at the early 2024. It is the cohort of the study of women's health across the nation, the SWAN study, and they found that women who had more heavy metals in their blood, they had lower AMH concentrations on their final menstrual period. And also, these women who had the higher concentrations of heavy metals, they had accelerated rates of the decline in AMH over time, meaning that there is an accelerated follicular atresia due to heavy metals. So definitely we know this is an Italian study, actually one of the first studies. It was published 4 years ago, showing again that the AMH levels are decreased following the increase in nitric oxide. So this is actually, they confirmed the well-known findings, AMH throughout the age range. But in the cases when we have increased levels of nitric oxide, then there is a major decrease in AMH levels independent of patient's age. So last year, this year actually, 2024, a study from Poland confirmed this finding. It was 511 women with infertility, and actually it was shown that those women who had higher levels of air pollution products, they had significantly decreased antral follicle count and AMH levels. So now there are more and more studies proving that. And this is the study that I mentioned to you earlier, that it was, it's not published so far at the Human Reproduction, but I think it will appear quite soon. They used frozen embryos because the investigators wanted to delineate the differences between oocyte quality and maybe differences in the quality of the uterus during embryo transfer and the conditions of embryo transfer. So they compared air pollution during the time of egg recovery. And what they found is those who had higher levels during the previous 3 months up to 2 weeks prior to oocyte pickup, they had a 40%, almost a 40% decreased risk for having a baby. So it is definitely a decreased oocyte quality, and I think this is a major finding that we should all be aware of. So a lower AMH is associated with earlier menopause and onset of menopause-related symptoms. Lower AMH have a strong association with the risk of early menopause. So I think maybe this is something that we should do in all of our patients, or at least inform them that maybe we should not only measure FSH, but also AMH, because it might be scary in how many big percentage of our patients we will see very dramatic decline in AMH levels. So maybe this can be something that we should use in order to inform them about fertility. And as I mentioned before, I will speak a little bit about male fertility. Actually, environmental pollution is not only causing male infertility, but also it has been associated with male reproductive system anomalies and prostate cancer and testicular cancer. A recent paper in bugs, in insects, showed the very dramatic decrease in fertility due to the global warming and the increase in temperature. It is well known that temperature severely affects male fertility, and actually these insects may not exist in the near future because of the increase in the global warming. So environmental pollution and climate change affects all aspects of male fertility, the concentration, the motility, the morphology, DNA fragmentation, everything. And I don't know what we will do in the future if we do not take action, but definitely climate warming is a very important parameter for the decline in male fertility. As I mentioned, these are some human studies showing a detrimental effect in all aspects of sperm morphology. And again, the same thing like in female infertility, it is not only causing epigenetic modifications, but also causing transgenerational epigenetic inheritance. So these are going to the next generations, and only God knows what will happen in the future. So male fertility is another major issue due to climate change. And of course, this has severe detrimental effects in the offspring. And we know now that it is associated with a decreased fetal birth weight, stillbirth, miscarriages, obesity during the very young years of the babies, many detrimental effects. So in conclusion, chemicals, air pollution, and climate change affect miscarriage rates, ovarian aging, sperm quality, stillbirth rates, and hormone regulation. Environmental effects on fertility can be difficult to measure and track, but many studies have linked environment to issues with sperm oocytes and the ability to carry a pregnancy to term. I think climate change can give an explanation why we have this increase in the demands for fertility services. And endocrine disrupting chemicals have been linked to impaired fertility, correlating with almost all reproductive disorders, not only decreased ovarian reserve, as I mentioned before, like endometriosis, polycystic ovary syndrome, etc., etc. So climate change affects every aspect. Actually, it decreases life expectancy because it causes a dramatic increase in cardiovascular disease and mortality. Particularly for the male fertility, it also has been associated with anomalies also in the reproductive system and transgenerational effects. So one of the major factors affecting ovarian aging is climate change. Maybe nowadays is the first reason for that, because the genes have been so far for so many years. Why we see an increase these days? I think environmental pollution is the answer. There are several mechanisms by these mechanisms. This is caused not only in granulosa cells, increased rate of atresia, but also in oocyte quality. I think the findings from the study that it was just published during the last ESHRE meeting is very, very important with the frozen embryos. So we have epigenetic and transgenerational effects in the reproductive system. And I think this was the reason also why the ESHRE had these fact sheets about environmental pollution. You can find them, and I have all of them here. This is about reproductive health, and they pointed out that it causes impaired sperm parameters, low ovarian reserve, reduced spontaneous fertility, compromised IVF outcomes, adverse pregnancy outcomes, and reduced live births. It emphasizes the detrimental effect in female reproductive health, as I mentioned earlier, in male reproductive health, and in the offspring, which is probably the most important aspect. So even FIGO now mentions that climate change puts human reproduction at a greater risk. And I think we should really try to work on this. And I would like to end with something that President Barack Obama said. We are the first generation to feel the impact of climate change and the last generation that can do something about it. Thank you for your attention.